few more to the chat. So I'm just going to wait a few more minutes and we'll get started here shortly, just in respect to your time. I'm trying to look to see if I recognize any faces here or if I see any names.
Well,
oh, Rosa. I recognize Rosa. How are you?
Yeah, we only saw each other with a mask on.
I know. Remember those days? Well, we're still wearing masks, but I'm not wearing a mask during the presentation just because I'm pretty much by myself here. So welcome. I hope you're doing well, Rosa.
Thank you. Yeah. Always the back.
Yes, I remember. We were treating you for your shoulder, but yeah.
Right.
Okay, so yeah, I'm gonna wait like another minute or so and then we'll get started, okay?
So you probably want everybody to mute and then only unmute if we have questions?
That would be great. That would be the best strategy is to mute yourself, especially if there's a lot of background noise. And then if you have questions, either raise your hand on the presentation here or you can also, yeah, we don't have anybody on the chat box today. So if you have questions, you'll have to direct them straight at me. A lot of times we'll have a therapist answering questions in the chat box. We don't have that tonight, so it'll just be me. So just, yeah, raise your hand. Yeah, say it again.
I'm in the chat box.
Will you be able to answer the clinical questions?
I will try my best.
All right. So if you do have some questions, put them in the chat box if I'm in the middle of the presentation. And Amanda, our lovely assistant who organized all this, will try to answer them for you.
I can also see the chat and direct them to you, Raul, so that you can address them in the group setting too, which might be good for other people to hear.
Yeah, that'd be great. If they're like an in-depth clinical question, then I can direct them to me once we get to that point. Okay, I'm going to get started just to respect everybody's time. I'm going to share my screen here. All right. Looks like somebody just entered the presentation. Welcome to our presentation. I'm going to get started here. Just give me 1 second here to get my slideshow. Okay. I think we're ready. Well, welcome, guys. My name is Raul Lona. I'm a physical therapist, and I'll be presenting tonight on low back pain and sciatica. Most of you guys who are here either have or have had lower back pain and sciatica, so I hope this presentation is very informational for you. Even if you just want to learn, we'll be talking a little bit about everything related to back pain in terms of the causes, some of the treatment, how we at M3 Physical Therapy can help you, get rid of back pain and get you back to living the life you want to live. And then also we'll do a little bit of, we'll delve into some ergonomics and some chair adjustments and desk adjustments that you can do for those of you, especially right now during the pandemic, who may be working from home and are having a hard time situating yourself in your work and home office. So a little bit about myself. I received a doctorate from from the University of Southern California, USC, back in 2001. So I've been doing this now for about almost 21 years. I received my orthopedic clinical specialist, which is another specialty degree on top of my physical therapy license in 2006. I've had over 19 years of treating orthopedic patients, specifically in the lower back. Probably treated thousands of patients with lower back and neck pain throughout my years. I've taken a lot of different specialized courses for physical therapy relating to the lower back, and I consider myself an expert. Have had several publications as it relates to lower back in terms of the treatment, as well as in the diagnosis of pain related to the lower back. Our clinic has also treated thousands of individuals with lower back pain. We opened our doors in 1981 back in the Beverly Hills area. Some of you
that number down. 818.
the West LA office. We have since opened another office in the West LA Valley. I'm sorry, West Hills Valley area. So wherever you guys are, if you guys need help, we are available to help you. I hope the information is valuable. And again, if you guys have any questions during the presentation, feel free to just catch my attention, raise your hand, or put it in the chat box, and Amanda will direct that question over to me. And just a little bit about the clinics. In both of the clinics, we have at least 3 therapists that are also specialists in lower back pain and sciatica. Some of them have had as much training as I have and have actually more years of service in the physical therapy field. So you don't have to see me if you guys choose to be treated at one of our clinics. Some of our therapists that are working with us have even more experience and specialty treating those areas. I am just a presenter from tonight, but I can certainly help anybody who needs help.
USC 2001.
Okay, so let's talk about low back pain. Let's first talk about the sciatic pain, sciatic nerve. The sciatic nerve, a little bit about the anatomy, is the largest nerve in your body. It originates in your lower back. It exits the lower back and travels down your gluteal or your buttock area on the side. That's why a lot of times people with sciatic or low back pain also report pain in their gluteal or buttock area, just because the nerve becomes fairly prominent in this area. It travels down the back of the leg or down the back and down the side to back of the leg here along the laser pointer here. And again, people can get sciatica pain along any one of this, along this path. The branches of the sciatic nerve split into 2, right below or right above your knee, and they terminate, the nerves terminate into the foot. And that's why a lot of times people report when they have low back pain and sciatica that they have also pain not only in their thigh, but possibly in their calf and even into their foot. So think of the nerve or sciatica. Sciatica is basically the pinching of that sciatic nerve. And the way it works is you want to think about the kink in the hose. Many of you guys right now who are watering your lawn or watering your garden, often when you're rolling out the hose to water your plants, have a kink in the hose, right? So what ends up happening is you get a gurgling sound, the water pressure goes down, and you're wondering, all right, what's happening? So you got to go back, trace the hose, unkink the knot, and then everything gets restored. That's exactly how sciatica works. There could be a pinching anywhere along the path of that nerve, either in the lower back as it exits the column, in the buttock, like I mentioned, in the thigh, in the calf, or sometimes even in the ankle. Wherever that kink is, we as physical therapists or even on an MRI can try to help figure out where that kink is. Because once, similar to a garden hose, when you relieve that kink or restore the straightness of the hose, the water flow should restore back to its normal state. And similar to sciatica, when you restore the kink at wherever it is along the leg, the symptoms will improve with time. So the only issue with sciatica is that nerve pain takes a while to heal. So when the nerve has been injured,
Excuse me, Raul, I think your office, somebody's talking in your office and we cannot hear you. Maybe they can mute themselves.
Yeah, let me get that taken care of. Amanda, can you please help with the noise in the background?
Yeah, hang on one sec.
I'm hearing a lot of noise in the background. Yeah, thank you, Rosa. So like I was saying, nerve tissue is very slow to heal. Unfortunately, nerve tissue is the slowest healing tissue in our body. So many of you, when you guys get sciatica or some kind of pinching of the nerve, it takes a long time. There's a certain, ratio that doctors or neurologists tend to talk about. It's 1 millimeter per month. So if you get an insult or an injury down by the ankle, there's a lot of millimeters between the ankle and the lower back. So that injury is going to take a long time to heal. And unfortunately, the people who often get the sciatica tend to be older in age, usually over the age of 60 at times. And unfortunately, as we get older, as you guys can imagine, the healing potential and the healing time also decreases. So a couple things working against you. But the good news is that you can heal a sciatic nerve pain. It can be healed with physical therapy, and we do it naturally without any invasive type of treatments. And we'll talk more about the treatments here in a second. I'm just trying to familiarize you guys with what sciatica is and how we treat it here at M3 Physical Therapy. Does that all make sense? If you guys have any questions right now is a good time to answer before I transition onto the different type of injuries that cause sciatica and lower back pain. Okay, I'm going to move on. Okay, the three injuries or the three causes of lower back pain and sciatica that I'm going to talk about are disc injuries, which is the most common cause, stenosis, also known as DJD, DDD, or degenerative disc disease, and simply arthritis. The third cause is sacroiliac joint dysfunction. I'll talk about all three. Now, just keep in mind that there's other causes, muscular strains, trauma. Those are all possible causes of low back pain and sciatica. I'm going to talk about these three because these are the most common ones that we see in the clinic and the ones that are within our wheelhouse that we treat most often and are very, quite frankly, successful at treating these. So let's first start with a disc injury, otherwise known as a herniated disc, or you're going to see that HNP if you get a prescription from a doctor. So a little bit more about the anatomy. So the disc is this white, bluish looking structure in between the vertebra of the spine. And the job of a disc is to create a cushion or a space. As the disc starts to flatten out or lose the fluid inside of it, this space starts to decrease. And I'll talk a little bit more about that when I talk about arthritis. Going back to the disc injury, it's the most common cause of low back pain and sciatica. Usually it affects people between the ages of 20 and 40. Most commonly, the cause is when you're bending and lifting something with rotation. Commonly, these people have pain when they're bending or when they're sitting for prolonged periods of time. So why does this injury cause pain? So to understand that, you need to understand kind of the structure of what the disc is. Think of the disc like a jelly donut, like a hard jelly donut. On the outside of the disc is like a donut that's kind of gone stale. So it's hard and it's got some substance to it. On the inside, it's got some fluidy jelly stuff called your gelatinous pulpusum. And when you injure that disc, like I said, when you bend, rotate, or lift something that's really heavy, as the most common cause, that injury to the donut part of the disc occurs and it could split it. Therefore, the disc or the jelly that's inside could leak out and put pressure on the nerve. And here you see that right here on the red part of this disc. There's been an injury to the outside donut part of the disc, and the jelly is starting to protrude out. And there's different levels of injury, which I won't get into here, where there's a bulge versus a herniation versus a sequestration of the disc. In essence, what you should understand is that because there's not much space here, when that disc becomes herniated, it puts pressure and inflammation on the disc, on the nerve that's nearby. And this is part of the nerve that creates a sciatic nerve that travels down your leg. So this is a kink in the hose that we talked about earlier. This is where the kink is for this particular individual who has lower back pain or sciatica pain running down the leg. These people, they tend to get relief with standing or extension. The reason being is that when you stand or extend, it opens up the spinal column a bit and actually can push the disc injury back to where it came from, therefore relieving some of the pressure on the nerve. Doesn't always happen, especially if you have a lot of inflammation. And that's the other thing with a disc injury is when you have a disc injury, you also get a lot of inflammation in the area. And the inflammation itself could be the primary reason why that nerve is being irritated or injured. So a lot of times just getting the inflammation down, and sometimes with ice, something as simple as ice on your back, rest, sometimes people take an Advil or an Aleve, that in itself can be enough to get the inflammation down and take the pressure off the nerve. Okay, does that all make sense to everybody? Does anybody have questions on this? This is usually the time where I get questions because they don't understand the anatomy or there's questions related to something that I talked about relating to the causes. Are we all good? Great. Okay, we're gonna move on to the treatment of a herniated disc. So Commonly, these people, when they hurt their disc and they have the low back pain and a lot of times the sciatica running down the leg, again, they're very inflamed, they're irritable, they can't do a lot with us in terms of exercises or a lot of manual manipulation. So we as physical therapists have to control that pain and inflammation. We have various modalities in our clinic, whether it's electrical stimulation, sometimes heat, we have laser or photomodulation therapy in our clinic. And the big thing that we do is we try to get our hands on people. One of the hallmarks of our clinic is the manual therapy that we provide. In fact, M3, one of the M's in M3 stands for manual therapy. So that's one of the hallmarks that you get at our clinic, is that we provide a lot of manual therapy, whether it's massage or joint mobilization, sometimes manipulation to improve the joint mobility and get the pain to resolve. And sometimes when you get the pain to resolve, a lot of times the inflammation can calm down as well, allowing us to move into the next phase of our treatment. When you come in for physical therapy for this particular injury, we do a lot of education. So we spend a lot of times talking to you guys in terms of what things you do not want to do that may aggravate that injury even further. Avoiding things like bending, twisting, those are all big things. And no lifting, because that's a big reason why people initially hurt their disc, is because they do a lot of bending, lifting, and twisting, which causes an injury on the disc and the nerve. These people, you want to avoid excessive sitting, obviously avoid a lot of lifting and repetitive activities. Cleaning your house is a big one. A lot of times our patients come back, they feel great on Friday when they leave the clinic, and they do some cleaning over the weekend because they're feeling better. And sure enough, they come back on Monday saying that I re-aggravated something. I think it was when I lifted or I tried to clean my house. So avoid the cleaning of your house. Get your family members to help you, and or find somebody to do it for you, because this will aggravate you most commonly, more likely than not. The next thing, once we get the inflammation down, once we get the pain under control, and we've educated you on things to avoid, we're going to do extension-based exercises with you with a method by Mackenzie, which I'm going to demonstrate here with my assistant. So give me 1 second. I'll get my assistant out here to start to demonstrate some exercises with us. She's coming. She's coming. All right. So I'm gonna stop sharing my screen here, and we'll come back to this in a second. I can't get there. Okay. Here we go. All right. So I'm gonna adjust my screen here. And this is our lovely assistant, Amanda. She's wearing a mask. So again, the Mackenzie's method of treatment for these types of injuries requires extension, so bending backwards. So what I'm going to have Amanda do is go ahead and flip onto your stomach, and we're going to get into cobra position. Okay, this is a very basic position. A lot of times I'll actually even just try to put them on their stomach in an extended position. And so actually, Amanda, just drop down into a full extension there. Just getting them into this position may be enough to start to influence that disc to be pushed back into where it needs to be, therefore taking the pressure off the nerve. If you can't get into this position, a lot of times I'll prop pillows underneath you. Sometimes I've had to prop up to 3 or 4 pillows to allow that person to lie on their stomach. This is a key position for those people who have a disc injury that's causing back pain and sciatica. Just getting onto your stomach can sometimes, positionally influence the position or the injury of the disc to push it back to where it needs to go. Once the pain starts to decrease and they're ready to move forward to the next phase, we're going to get them up into an extension position, which is where we started, and then up into a cobra position. So here, further influencing that extension of the lower back to try to influence that nerve, the disc to push back to where it needs to go. If that's okay, then we progress this particular exercise into what we call an upward facing dog in yoga. So she extends her elbows, further accentuating that extension, further pushing that disc back to where it needs to go. Okay. And this is commonly an exercise that you will do as homework, several times during the day to try to help you relieve some of the symptoms, not just when you're in the clinic, but also when you're at home. What you do at home is probably the most important part of your treatment. We educate you on what to do, how to do it, how often to do it, and we rely on our patients to be, good and compliant with doing their exercises, because that's when they're going to get, significant relief, is when they're doing their exercises at home. Some strengthening. We definitely need to strengthen these patients because a lot of the muscles that attach onto the vertebra can influence the stability of that disc. So if we strengthen the muscles around the abdominal or the core, it can really affect the healing of that disc as well and take the pressure off the nerve. So the first thing we do is we're going to go into a plank position with Amanda. So you're gonna stay on your knees, but you're gonna bring your hips up and into a plank on her knees. So already in this position, she should feel her trunk muscles, specifically her core, starting to work. And if we did this long enough, Amanda would start to shake, because I think she's slacked off on her exercises and probably hasn't been doing much of them. And she has a history of some hip and back pain.
30 seconds.
So once she's beyond this point, then we start to go, and let's say in a week or two, she's getting stronger, then we're going to progress into off of her knees. So Amanda, let's go off of your knees. So yep, curl your toes underneath you. And now we're going into a full plank or the top of the push-up position, okay? And again, we'll advance her by increasing her time, increasing her reps, increasing the duration, or increasing the time, the number of times she does them at home, okay? Take a break from there. And that's the demonstration that I wanted to show you guys for a disc injury and the common progression that we use in our clinic for somebody with this type of injury. So thank you, Amanda. She'll be back in a bit once we start talking about arthritis and DJD. Okay, so let me share my screen again and go back to my slides. There we go. So with this extension-based exercise, it's commonly what we do with a disc injury. It doesn't always follow that. Not everybody presents exactly the way it's talked about in the textbook. We modify things as able. Sometimes we may do more flexion-based exercise depending on the person. So we individually evaluate you to make sure that we know not only exactly what kind of injury, where that kink is to take the pressure off the nerve, but what exercises not only do you need based on your injury, but also how you're responding to the exercises. Because sometimes a patient may not respond to those extension-based exercises because it's putting too much pressure on their back. So we will modify them. And that's the hallmark of our clinic, is that the care you receive at our clinic is very individualized. We don't just give you a set of exercises because that's the common exercises that are given to somebody with that injury. We really find the deficits that you present with and address them with very specific exercises, and then adjust them as you are going through them in case they're either too hard or not the right exercises for you. So, but the key is the evaluation, to evaluate where that kink is coming from and how to most appropriately treat it. Any questions on that before I move on to the next common cause? Okay. All right, so the next common cause of low back pain and sciatica is somebody with stenosis or arthritis. Sometimes you'll see it as DJD, which stands for degenerative joint disease, DDD, which is degenerative disc disease, all a degeneration of the structures of your lower back. So if you look at our slide here, let me get my laser pointer out again. This is the spinal column. The vertebrae are here. This is looking at a side view of the spinal column. And you can see that this doesn't look like the slide here. This looks like a nice young spine, because this particular injury, the disc injury, affects somebody between the ages of 20 and 40. Arthritis is somebody with, about 50 candles on their birthday cake or more. So if you're over the age of 50 and you have low back pain and sciatica, this is probably you. This is probably the way your spine looks. Unfortunately, as we get older, your spine starts to degenerate. You can see here that disc that is plump and healthy looking here in the disc slide is no longer like that here. It's flattened out. It's lost that fluid or gelatinous pulpusum that I talked about earlier. And now that disc is very flat, where it might have been 2 millimeters in height. Now it's maybe a 0.5 millimeter. And that creates a loss of space. And you can see that here, that there's no space here and that nerve is being entrapped. These people present with pain with standing and walking. These people, when they walk or they stand, they get pretty immediate pain or pretty shortly after they start to walk or stand. These are the type of people that you see at Costco or at Target leaning over their shopping cart, because they're trying to bend forward to open up the space here to take some of the pressure off of the nerve. Commonly, these people get relief with bending or sitting, because it will, again, when bending forward, it will open up the space to take the pressure off the nerve. Sitting will also take the axial compression off of the spine when you're sitting, because in a standing position, there's a lot of axial pressure caused by gravity onto your spinal column. When you sit, that gets cut in half and potentially takes some of the pressure or the significant pressure off of this nerve. So big contrast here between, essentially, if you want to look at it, stenosis and herniated disc are almost the mirror opposites in terms of the causes, as well as what causes the pain, as well as what relieves the pain. Does that all make sense to everybody? Yes? Okay. So common treatments. Again, these people, depending on the stage of injury or the stage of healing, can come in with significant pain, significant swelling, significant nerve irritation. And again, these people, before we get them moving with manual therapy and exercises, we have to calm that pain down. And we can do that with, again, the various modalities we talk about, which electrical stimulation, heat, ice, photomodulation, which is a type of laser therapy. And again, getting our hands on people, the hallmark of our clinic in terms of treatment of various low back and sciatica injuries. And sometimes the pain may be so severe that we may have to call the doctor and say, hey, this person may need a simple, Advil, high dose ibuprofen, all the way up to a steroid pack. And the doctor a lot of times will concur with us, because they realize that in order to get that patient to the next phase of the rehab or healing, they need to control that inflammation. So we have a good relationship with our referring physicians that we can help collaborate with in terms of controlling pain early on that isn't responding to physical therapy and might need some kind of steroid or medication treatment. Again, a lot of education with these patients. With these particular patients, we want to tell them to decrease your upright activity, avoid a lot of standing, avoid a lot of walking, promote positions where you're flexing forward, sitting, to taking that axial pressure off of the spine. Sometimes sideline positioning can be very helpful for these patients, where we'll prop them with a pillow underneath their side, put them on their side to relax the muscles, and then open up their spine with that sideline prop position with a pillow. These patients sometimes can respond to track. Track is a modality where there's a harness attached to the lower back, and it's attached to a machine that creates a pulling sensation, therefore pulling the back and again creating space in this area of the spine that's lost space because that disc has degenerated. Nerve mobilization is something we commonly do with these patients, because again, that nerve has been injured here, and nerve mobilizations is a good form of treatment to start to get that nerve pain to calm down. What nerve mobilizations do is they start to restore blood flow to the nerve. It starts to exercise and stretch. I'm not going to say stretch, it glides the nerve, it gets it moving to take the pressure off of that nerve. And then finally, when that pain is under control, the nerve pain is under control, we can move on to the exercise portion of their particular treatment. So I'll have my assistant come back out, and we'll demonstrate a few of the exercises that we commonly treat for a patient with stenosis or arthritis. Okay, so we have Amanda back here again. So again, these people that come in with sciatica as it related to stenosis or arthritis, we want to try to open up their spine. We want to try to get the vertebra to separate a little bit to create some space for that nerve. So commonly we're going to do some knee to chest exercises. So I'm going to go ahead and pull one knee to your chest. And as she pulls the knee to her chest and takes up all the slack out of the hip, the back starts to stretch and open here. In fact, actually do this one, Amanda, so they can see here. So as she takes up all the slack out of the hip, it starts to open up her spine or her lumbar spine to take some of the pressure off the nerve. If she can tolerate this, then we'll go to double leg, knee to chest. Go ahead and go forward. Good. And pull. And we're going to hold. And again, an exercise that we're going to have her do throughout the day to, again, take some of the pressure off the nerve. Remember, some of the most important part of your treatment is what you do at home. So the positioning and obviously doing your exercise is huge in terms of your potential to rehab. Okay, so let's demonstrate a child's pose. So another common stretch that we'll do for these people, if they can tolerate being on their knees, is a child pose. This is another yoga stretch, where again, you can see her opening up her spine, creating space. If you can do an x-ray and look at her spinal column, you're gonna see some space in between where they've lost that space due to the arthritis to take some of the pressure off the nerve. And again, something that I'm going to have her do several times during the day, holding for long periods of time. Okay, so Amanda has completed 3 or 4 weeks of therapy. She's feeling better. Her stretches have been really effective. The inflammation and the pain is under control. We're going to start to do some strengthening. And a common exercise we may do is some pelvic tilting, where she's tilting her pelvis, again, creating a space in her spine, and then rolling up into a bridge position to again create space. And now she's starting to strengthen her glutes, starting to strengthen her core and some of her back muscles to better support her spine. And then roll it back down. And then roll it back up. Good. And roll it back down. Again, something we'll ask her to do several times during the day. Not as much as we do with stretches, because strengthening can be a little bit irritable if you do too much of it. So we will give her an exact number and reps to do at home. All right, Amanda, thank you so much. We'll bring Amanda back out one more time when we talk about sacroiliac joint pain. All right, I'm going to share my screen again. Here it is. Anybody have questions with that at this point? We good? All right, so let's move on to sacroiliac joint pain. One of the common, this is the third common cause of low back pain and sciatica that we'll talk about, and this is one that's often missed. Okay, something that again, I've been doing this for about 21 years, and this is the one that, patients that come in with this particular problem that has been missed by other physicians or other clinicians. This is the one where the patient says, I've been to other physical therapists, it's never helped me. My doctor told me to come to you because he told me that you might be able to help me. And a lot of times it's because of this problem. It's commonly missed, but when we catch it and we, render the appropriate treatment, these people get better really quickly. This particular problem affects people of varied ages. I've seen from 13-year-olds all the way to 80-year-olds have this problem. And essentially what it is an obliquity or a shifting of the pelvic bones that creates a strain on the ligaments. So if you look here at the slide here, let me get my laser pointer out again. The pelvis are 2 innominate bones, as we call them, that form a joint in the front of your pelvis at your pubic bone, and in the back, they form a joint along these red hot spots area with your sacrum. Again, it's called your sacroiliac joint along my laser pointer here. Along this joint, there's ligaments that, when they're pinched, are painful, just like the ligaments in your elbow or in your knee. When they're pinched or when they're irritated, they're going to cause pain in those areas. Same thing happens here. When that pelvis is rotated, let's talk about the left pelvis here. It commonly rotates back or posterior, creating a strain on those ligaments that live right here. And remember, the function of ligaments is to hold 2 bones together. So when you have a rotation through that pelvis that creates a strain on that ligament, it's going to cause pain. And sometimes that pain can be severe enough that the sciatic nerve that passes right underneath here can get irritated either by the rotation of the bone or most commonly because of the inflammation that ensues. Okay, so that's the common, the presentation that we see. These injuries tend to happen for somebody who fell. Either they fell back, they lost their balance and they fell and they landed on their backside on one side. That is enough trauma to shift that pelvis out of alignment and cause a strain on those ligaments. Females tend to get affected more than males simply because the female pelvis moves more than the male pelvis. And that's simply due to just, the fact that females' pelvises need to move for birthing purposes, because the birth canal is right there and the babies need to pass right through there. So the female pelvis is inherently more mobile than the male pelvis. So they tend to have more of these types of injuries because essentially it is a movement of, or a shift or a rotation of that pelvis. These people tend to have pain with transitionary movements, getting in and out of their cars, getting in and out of their bed, sit to stand type of exercise movements, twisting movements. Those types of movements are the ones that cause these people pain. Sitting can also be a common aggravation for these people because of the pelvis is rotated. They're now, the sit bone, which is right here, is now shifted, and now they're sitting on a different part of the sit bone, which can cause pain. And the last thing and the common thing that I also see is when they come into the clinic and they point to their backside, but not quite on their booty, but not quite on their lower back, they usually point right to their sacroiliac joint, and I start to hone in on that this particular diagnosis could be the cause or the kink in their lower back that we need to fix and treat. Okay, so treatment. The biggest thing that we do for these people is we try to get their pelvis to realign itself. Okay, it should be level and symmetric. And if it's not, we will quickly do a repositioning of their pelvis. And there's various types of repositionings that we do. Sometimes we just give people some exercises to contract their muscles to bring their pelvis back into alignment. Other times we may manually adjust it. I'm going to demonstrate tonight an adjustment that we do to try to get people's pelvis to go back into position. Let me position the camera so it's angled appropriately so you guys can see this. Okay, so this is a grade 5 SI joint mobilization. We call them grade 5. We don't call them adjustments, but they are essentially an adjustment that a chiropractor would do. And we are trained and licensed to do, I'm not going to say adjustment, but grade 5 passive mobilization. So I'm going to stop sharing my screen so I can share my camera. And okay. Okay, here we go. All right, Amanda. Let's see if we can see her. All right. So here's Amanda. She's coming in with pain. We in our sacroiliac joint, we diagnose that it's a rotational problem. So we're going to try to adjust this. So Amanda, I'm going to come from behind you. Let me see if we have a good angle here. I think this will work. Let me just raise the table a little bit. So my determination in the clinic was that she had a left posterior rotation. So I'm going to try to rotate that pelvis back to where it needs to go. So Amanda, I'm going to pull you this way. Good, right there. I'm going to swing your feet around this way. Cross right there. Okay, good. And then I'm going to swing this around that way. So Amanda, I'm going to have you interlace your hands behind your head and then close. Good. And then I'm going to have you do like a crunch up to help me. And then I'm going to flip you on the other side. There we go. Okay. Keep this rotation. Keep this side bend. And then I'm going to rotate her further. Grab some skin because that helps me grip. Here. Here, and already she went. Okay, and it's just a quick burst adjustment to try to get that pelvis to realign. Come back up, Amanda.
I feel too good.
You feel better?
I feel so good.
Adjustments are something that, yep, you're good. Thank you, Amanda. That is done in treatment, and it feels good at the moment, but that's not just the only treatment that you need. So if you go somewhere where they just do an adjustment and they send you home and think that you're going to feel better, you're going to feel better for the moment. That pain will usually come back. There's other things that we need to do, which we'll talk about next. So if it's a problem where the pelvis is out of alignment, once we get it back into alignment, we really have to work on the strength and the flexibility of that person. Strength is really important because those muscles, again, attach directly onto the pelvis. So we need to strengthen those with core exercises, which were demonstrated earlier. Flexibility is huge. Most of these patients have an asymmetry in their flexibility, meaning that one side of their body is more flexible than the other. Therefore, the side that's more stiff or less flexible tends to pull harder, so it could pull that pelvis out of alignment very easy. So we tend to identify what muscles are weak, which muscles need to be stretched, and we administer, we give the appropriate exercises for that. Once the flexibility and the strength has been restored, then we start to progress to more functional positions, depending on what you want to do. A lot of times, like I said, females tend to be affected more than males. So we will get back to doing the things that, it's to Pilates, whether it's carrying the baby, any of those things that are causing you pain. We will work on specifically the appropriate treatment. So when you come into, when we talk about back pain, one of the common things that we tell people, and sometimes it's too late because it takes them a while to get into our clinic, is when you have back pain or if you have an acute injury, don't delay in getting treatment. A lot of times people, like most of us, when something happens, when something starts to hurt, what's the one thing that we do? We try to ignore it, right? When something happens in our life that requires us to do some work, or could potentially require us, we hope that it just goes away and you don't have to do anything about it. So we tend to ignore the pain. Other times we tend to alter the pain. What I mean by alter the pain is we will, take something for it. We'll take some Advil, we'll take, something for it to go away, and we don't do anything else. That's altering the pain, because yes, the Advil may help at the moment, but you need other type of treatment to get to the cause, the kink of your pain, to get the appropriate treatment administered. So we really advocate for you guys to handle your pain. Stop ignoring the pain. If you've had it for months or sometimes even years, get treatment, because if we identify what the kink of the problem is, we can administer the appropriate specific treatment to get you back to, living pain-free and help you heal naturally without any invasive type of treatments like surgery or injections that commonly are done out there. Delaying treatment can cause significant healthcare costs downstream. So what ends up happening is if you ignore your back pain, you end up, making the problem worse, because it gets more complicated the longer you wait to get treatment. Then you need to go see your primary care doctor, who sends you to your orthopedic, who sends you for an MRI. That's already 3 visits that you've done, 3 copays, 3 potential days where you've taken 2 hours away from work. So all those costs add up. We feel that M3 is that if you have an acute back pain injury that came on suddenly, or there's an injury that occurred, come get treatment, come see us. We offer free screens. We also offer evaluations. The difference between a free screen and an evaluation: in the free screen, you're going to meet with a licensed expert physical therapist that's going to try to identify the kink of where your pain is coming from and talk to you about the treatment options that you could potentially receive. So there's no treatment involved in a free screen. To get a treatment, once we identify the kink and the cause of your low back pain, it's for an evaluation. So you schedule an evaluation, you're going to get both the diagnosis and the treatment of that back pain right away that same day. So you could potentially start feeling better that first day you meet with your physical therapist. So like I said, we are experts at treating low back pain. We've been doing this for 21 years. So if you do have back pain, which I know a lot of you guys here joining us tonight do have, consider coming to M3 Physical Therapy, because again, you're going to get specific treatment that is specific to your particular body type, to your particular injury, and to your particular response to the treatment that we're administering. Anybody have questions before we go on to ergonomics, before I move on? It's a quiet bunch tonight. Okay, ergonomics. For those of you guys who are working from home and don't have your regular chair that you normally would have in your office because you couldn't bring it home to your home office, this could be an important topic for you, because we're getting a lot of patients that have been working from home for the last year during the pandemic for low back pain, for neck pain, because they're in a bad position, especially now that our workforce is working or are working in front of the computer a lot. Being in a bad position, being in a bad chair, and being in front of a screen typing or mousing or on the phone can cause injury without a lot of trauma. It's that repetitive use type of injury that sometimes tends to be worse than trauma. So when you talk about home ergonomics or home office considerations, and we talk about a chair, you want to fit the chair to your body size. Okay, so consider your posture and alignment. This is a good picture of the alignment that we try to incorporate or emphasize when we're trying to help somebody get the proper chair that fits them. There's a lot of 90-degree angles that you see here. There's a 90-degree angle here at the hips, 90-degree angle at the knee, and 90-degree angle at the elbow here. Notice that there's armrests to help support the forearms, especially for those people with neck and shoulder pain. If you're typing and doing a lot of mousing in front of a computer with your arms unsupported, the muscles in your upper trapezius and neck and shoulder will get tired after a while, especially if you're not exercising, and develop a repetitive use type of injury, inflammation, and pain that becomes limiting for you. Again, fit the chair to the size of your body. Okay, not everybody is going to fit in the same chair, male versus female. Some people have longer legs than others. So you want to consider the seat pan depth. This particular seat pan depth, this is not the greatest slide because it's black chair with black pants, but this seat pan, it fits this particular individual perfectly. It comes out just short of the back of the knee, supporting most of her thigh. Notice that she has armrests, which she's using as she's writing on this desk, which is going to help significantly take any strain off of this area of her neck. And then notice that she has some nice lumbar support that she is using. Commonly, what happens is people sit on the edge of this chair and never use this lumbar support. And after a while, that could be another cause of lower back pain with this repetitive type of use, because some people are working up to 3 or 4 hours consecutively at a chair and not taking breaks. And then the other thing to consider with the chair is to make sure you have a lot of adjustments so that you can adjust a chair to fit your particular size, whether it's a lumbar support, a rise or decrease in the height of your armrests, or turning in or turning out of the armrest to allow you to support yourself. The other thing to consider is fit the chair to your spinal attributes. And this mostly refers to males versus females. Males tend to have a stiffer spine and they're going to want to lean back and tilt back. Therefore, your chair should have a tilting option. Females are going to tend to have a more arched lower back. They're going to need more lumbar support. Similar to this picture here, obviously this being a female, there's a nice lumbar support to nicely support the arches of her lower back. So this is a common position that a female should take. Males, you're going to want that back support, but you're going to want that tilt to occur because your pelvis tends to be more flexed as well as your lower back. The other thing you want to consider when you're getting a chair is to allow for, or when you're talking about ergonomics and chair positioning, is allow for movement. You want the chair to allow for reclining and tilting. Okay, so good examples of this are here. This chair, again, a male, allowing that chair to tilt back. Again, the male spine tends to be stiffer. We tend to be wanting to be more in a flexed position. So you want that chair to tilt back and allow a lot of freedom of movement. Okay. So movement will be key, and we'll talk about that in a second. And so why is movement important? It's because it avoids a lot of that static positioning that muscles do not like. Muscles are very dynamic. They are meant to move. Their job in life is to move bones. And if you are in a position where you're statically holding yourself in a position and the muscles are not moving or contracting, eventually you're going to have pain. Try sitting in a chair for 3 to 4 hours without moving. Something is eventually going to get achy because the muscles do not like to be in a static position. They like to move. When you put them in a static position, there's going to be anoxia, which is essentially a lack of blood flow and oxygen to those muscles, which is going to eventually cause pain. We recommend taking 5-minute breaks, 1 to 5 minute breaks every 40 minutes. So if you sit in front of a computer all day, every 40 minutes, put a timer on your Apple Watch or your Alexa to remind you to get up. They also sell programs that you can do screensavers that will allow you to get reminders on when to sit up. Best for you to actually get up out of your chair and do some stretching, okay? Which I'll demonstrate here in a second. And then consider a sit to stand desk. Okay, so see, these are some common stretches that you could do, just some neck stretches here to mobilize your neck. Twist your thoracic spine, which commonly is where a lot of the pain occurs for people who sit for long periods of time, or a nice stretch, which we demonstrated earlier for a low back. And then even getting in a doorway and stretching your chest out. So stretching and movement, really, really important for those of you guys who are sitting for long periods of time in front of a computer. And again, consider a sit-to-stand desk. Changing positions, again, allowing for movement, allowing for change in position, really important. These have become very popular these days, especially with the pandemic, with more people working from an office at home, allowing for the sit option or standing options to, again, get your spine and your muscles and bones out of the same static position. They're even coming out with bicycles that act like desks, so you can actually exercise. There's also treadmills that have a desk platform on them to allow you to walk and ride and move your muscles while you're working. So these are really nice options that are out there available for you guys. I have a short video here to show you guys. Are you guys interested in watching this video? She's going to talk specifically about how to size your chair for this particular chair. Is that something you guys would be interested in listening to? It'll take 2 to 3 minutes.
Yes.
Yeah?
Yes.
Okay, so let's play this. I hope it plays. Let me go back. Let me get rid of my pointer here. All right, guys, I don't know if it's going to play tonight. Let me do this. Let me see if I can get out of this. And let me just go to my slide here. I'm going to play from here. No, guys, it's not sharing or it's not playing right now. Sorry about that. Essentially, it covers a lot of what we talked about already in terms of adjustments that you can make, making sure your seat pan is the appropriate depth, and making sure you have armrests that can be adjustable, as well as lumbar support to help support your spine. Okay, so I'm going to stop sharing this. Okay, that's going to conclude the presentation. I would like to open up for any questions that you guys might have about anything we talked about related to disc injuries, arthritis, sacroiliac joint pain, any of the ergonomic information that we shared. Any questions that you guys may have? Let's see. Edward, go ahead and unmute yourself. Let's see, hang on. Let me unmute yourself.
Okay, got it.
Go ahead, Edward.
For home use, what devices would you recommend your patients to use before their next visit to help relieve the pain, other than just taking typical painkillers? What can they do other than stretches or painkillers?
You're talking about devices like
a Fisher traction device,
yeah.
or a yoga ball.
So if it's not a current patient, I would always encourage them, we would need to see what's causing your back pain, right?
Mm-hmm.
We need to identify where that kink is coming from, because some kinks or some causes of low back pain may not respond to, like, for example, traction you mentioned. So I don't like to generalize treatment and say, all right, use this because this is going to be helpful no matter what the cause of your injury is. So
Mm-hmm.
if you're having like an arthritic type of problem or a stenosis type of problem, traction may help you. The studies say that if it's going to help, it's somebody who has a stenosis arthritic type of problem. So if that is your problem, or that is your kink, traction may be helpful. You've probably heard of the inversion tables.
Yes.
That tends to be somewhat helpful for those people with more of an arthritic stenosis problem. However, I always comment and I caution people, especially people over the age of 50, which again, we said people who have arthritis tend to be over the age of 50. I don't necessarily advocate those machines, because the inversion table, and even if you're in that position for a minute, it tends to bring a lot of blood flow to your brain. And to me, that could be a dangerous situation with an aneurysm or some kind of stroke. So I tend to not promote those for home use for somebody with that type of problem.
I also been using this product just recently, and I have a combination of a herniated disc and sciatica. And part of the sciatica was that I wasn't exercising enough, mainly the core, lower back, and my glutes.
Yep.
Which kind of, like you said earlier, with the disalignment of my hip. So that this, what I showed you, actually helps with the stimulation of my back muscles.
Is it
So
a
I've noticed,
stimulation machine, Edward?
let's see,
Like electrical
corrected.
stimulation?
Yeah, it's like some type of FDA approved medical stimulation device.
Okay. So
And
there's a lot of those on the market. There are TENS machine, and yeah, though it's something I mentioned in our presentation that electrical stimulation can be beneficial in terms of controlling pain. The only problem, Edward, and it's really not really a problem, is that it's only going to help while the electrodes are on your back and the machine is on. Once you take it off, you might get a little bit of a latent pain relief, but it usually will go away pretty quickly. So again, a temporary, solution. We feel more that active therapy tends to be more effective, and so do the studies that we commonly refer to, is that active therapy tends to be a lot more beneficial. But sure, I mean, if you have that and it's giving you some pain relief while you have it on, by all means, use it. Sure.
how about another question? Incorporating kinesiology with chiropractic treatment. What is your take on that?
So kinesiology. Be more specific about that. So kinesiology is be a movement, right? You're talking about kinesiologic tape?
More like, kind of like chiropractic, but more in a way, adjustments to straighten out. Like if one leg could be a little shorter than another, there, because there's probably some kind of hip displacement.
Yeah.
Not exactly like an adjustment where you're cracking a portion of the body, but more like tug and pull in a way.
So again, can be effective. We do adjustments here in the clinic. We won't call them adjustments. We call them graded passive mobilizations. And it just depends on what the problem is. Again, where's that kink? What's causing the kink? Are you appropriate for a joint mobilization that could relieve pain? Yeah, and that could be effective. It tends to be most effective with people with a sacroiliac joint problem. But we do them with other injuries to the lower back and sciatica. So I guess to answer your question is it really depends on what we're dealing with. Again, this is why the evaluation is so important. Why, trying to identify where that specific kink is coming from and what's causing the pain on the structure of your back or the nerve.
Excuse me, Raul, I wanted to thank you. Very good presentation. I will call your office. I have to leave now. So thank
you. Look forward to seeing you, Rosa.
Thank you. Okay. Bye-bye.
Yep. Edward, did that help? Did that answer your question?
Yes, it did. And thank you for your presentation, by the way.
Just one last thing, Edward. The studies have shown, and something we commonly will implement here in the clinic, is if you have, if the onset of your back pain has been within 14 days and you don't have any symptoms going down the leg and you have a certain amount of range of motion of your hip, you tend to be a category that's going to respond really well to a spinal adjustment to get that pain under control and give you some long-term pain relief. So again, less than 14 days, no pain down the leg, and just centralized lower back pain with good range of motion of the hip tend to respond very, very well to spinal adjustment.
Recently, I went in for my second chiropractic treatment, and I ended up coming out worse than I was coming in. And I had an inflamed herniated disc at the time. What he did was, where I turned to my side and folded my leg and over to the right, and he was trying to do that adjustment. So is that typical protocol for trying to adjust the back? Or
so it sounds like lumbar rotation. Were you having pain down your leg, Edward?
No.
Okay, so pretty much just centralized lower back pain. There's many different ways to adjust a lower back. What I think here as a demonstration is one that I commonly use. So, basically what we're trying to do is get that cavitation of that joint to move in a quick manner to try to get some of that pain under control. There's a lot of theories about what an adjustment does, whether it slightly adjusts the joint back into place or aligns the vertebra a little bit better. Science behind that. There's no research that says that that's what actually happens. I believe what happens during those adjustments, you get a quick proprioceptive stretch on the nerve and the joint, and that tends to release a little bit of enkephalons and endorphins that gives you some of that pain relief pretty quickly, after. So, yeah, because
Gotcha.
I've never seen any literature that says that the adjustment actually puts the vertebra back in the position where it needs to be. That's something that's never been proven.
Thank you.
Yep. Nita, I think you had a question, right?
Yeah, I have a question here from the chat box from Nita.
Yep.
She wants to know, what is degenerative disc disease compared to sciatica?
Well, degenerative disc disease is a cause of sciatica. If you remember on our slides here, I'm going to go back to my slide. Nita, are you still there? It says she's still here.
Yes, I'm here.
I'm going to refer back to this slide here. So this is degenerative disc disease, a loss of height of the discs, some bone spurring here, which causes a decrease in space. Essentially, these people have a loss of space for that nerve to exit the canal. And that nerve being pinched is going to cause pain on that nerve, which is eventually that nerve travels down the leg, cause that sciatica. Okay, so that's how the arthritis or the degenerative disc disease relates to sciatica. The pinching of the nerve is going to cause the pain down the leg or the sciatica.
Now that can happen at any age, or is it because my 28-year-old son, he was having lower back pain, and he had went to the doctor and they said that it was the degenerative disc disease, and they sent him to, I think they sent him to a chiropractor for help with that. Right. And he says it really didn't help him out much. And they tried to do physical therapy. I guess maybe they suggested like aqua therapy would probably be the best route to go or something like that.
Yeah, I mean, there's always exceptions to the rule, Nita, but I don't know. I mean, usually arthritis of this type of problem, degenerative, is usually somebody over the age of 50. 28-year-olds are going to get more of the disc injury, which is this one here,
right?
And or some kind of muscle strain or muscle imbalance that needs to be worked on manually as well as strengthened.
Yeah, that's what he was wondering, if maybe they just misdiagnosed it and said it was disc degenerative. So
yeah, it's more common that he's going to have this type of problem. Does he have pain down his leg?
I don't think he's mentioned any pain down his leg.
Yeah. So it could, could be just like a muscular type of problem. That's another, reason, one of the bigger reasons I didn't talk about today, just because it is common in the clinic, but it's a little harder to incorporate into the presentation. But it is something that we see commonly. I don't know what your son's history is, what he does for work, or is he active, but that's commonly what I see for those people. If it's not a disc injury, which can be diagnosed via MRI or sometimes a clinical presentation in our particular setting. Muscle is another area to look into. And again, given his age, highly doubtful, but again, there's always exceptions to the rule that it's something like this.
Right. Okay.
If you want, we can certainly take a look at him and see kind of where we think the kink is coming from, and try to help him with this problem.
I'll mention it to him. We live out in San Bernardino.
Okay, you guys are far.
Yeah.
Yeah, I mean, there's a lot of good clinics out in that area. I would look with somebody with the designation that I presented here earlier, an OCS or an orthopedic clinical specialist. So when you're looking for a clinic near your area, call them and say, do you have any therapists with this OCS or an orthopedic clinical specialist? Which most of our therapists either have it or aspiring to get that in our particular clinic. The more training you have, the more education, to me, the better. So.
Right. Okay. Thank you.
Okay. Anybody else have any questions?
Hello, I had a question.
Yeah, go ahead.
Yes, hi, good afternoon. Thank you for your nice, helpful seminar.
Yeah.
I was calling regarding my father, 86 years old, and fairly, he just been not quite able to walk normally, and it got to a point where even 3 minutes of walking, he would not be able to continue. So his back would arch. He had no major accidents, and he lives a normal
Yep.
dormant life for the most part. And he recently got an epidural.
Yep.
And it relieved his pain. He's able to fully to stand erect,
Great.
and it's better now, but only lasts about 3 months.
Yeah.
And so next is physical therapy. So my question is, if this was your father's situation, what would be the game plan, the most important thing of the do's and don'ts?
Yeah.
And
If that's
what
the,
would be something, yeah, in terms of treatment and during non-treatment time,
yeah.
what he should be doing?
Yeah, good question. So if the diagnosis, and it sounds like it's right, an 86-year-old is going to commonly have that degenerative stenosis type of problem that we talked about. Education is a huge part of this.
Right.
Avoiding things that are putting him into an excessive amount of standing or walking in the beginning, Brian, because we eventually want to get these people walking, but we have to continue. We have to first take the pressure off of the structures that are being irritated. In this case, probably the nerve. So and that's going to allow it to heal. Once that nerve starts to heal, there's going to be a significant decrease in the pain with standing and walking. And we're going to be able to progress them to a more functional type. Because most people come into the clinic at that age, they want to be able to walk. And with that particular diagnosis, people can't walk for long periods of time. It's a slow process. You may have missed some of the presentation where I talked about the healing of the nerve. It's very, very slow, especially in somebody of that age. So there's a lot of patience and diligence that is involved. Coming into my clinic, I would have, initially, if the pain is under control with an epidural or some kind of medication, then we're going to get going into a lot of strengthening and education. Just because the strengthening is going to be so crucial to stabilize something I didn't talk about, which can be a little confusing for people. Let me go to that slide. You see the collapse of this disc here? I'm sharing my screen now. Hopefully you can see it. There's ligaments that attach from one vertebra to the other.
Yes, treatment for HMP.
So
right.
That's a herniated disc. So what I'm trying to illustrate here is that when these vertebrae collapse in a stenotic or arthritic spine, the disc also, the ligaments that attach the bones to each other also, where they're nice and taut and lengthened, they are now slack and loose. And the whole purpose of ligaments, like I mentioned earlier, is to hold bones in place. When those ligaments go loose and slack, those bones are moving and shearing a lot more than they need to. That shearing and movement creates inflammation, and that inflammation could cause a lot of pressure on that nerve. So one of the hallmarks of treatment for us is to strengthen these people, to get on a good core strengthening exercise. If you're going to a clinic and you have this diagnosis and you're not doing any strengthening, I can almost guarantee you're not going to get any benefit from it. So for your particular father, whether he has pain relief with the epidural or not, he needs to get into some strengthening pretty quickly. Because a lot of times these people have been in so much pain for a long time that they've been sitting around doing nothing because it's hurt so much to walk and stand, let alone do exercise. So they've become significantly deconditioned.
Right.
So they need to strengthen to stabilize this
Sure.
and to get back into some kind of condition so that they can, once the pain is under control, they can resume doing some kind of walk.
I see. And from the prior clients in similar situation in terms of their recovery and time period, how long would you say that would normally take, and what would be a daily routine that would be recommended?
Yeah, for this particular diagnosis, it's months. I mean, literally like 3 to 4 months. Doesn't mean they have to come into the clinic, times a week. Sometimes we started 2 to 3 times a week, and then we as they start getting better, once a week, sometimes once every other week, sometimes a couple times, maybe once a month, as things start to get better. So that's a common progression that we see. So it's a month, because again, it's usually somebody over the age, a particular father over the age of 80. It takes a long time to get that nerve and the structures to heal. And so it's a slow moving, animal. So it's a months process. Typical strength, advice that I give them at home is, in the beginning, avoid a lot of upright standing and walking. Do a lot of stuff on your back, on your side, and sitting. The stationary bike may be something that's beneficial because at least they're moving their legs in a sitting position. And again, the sitting position tends to be a position that is not aggravating for their particular pain. And then just start to strengthen. And their therapists, if they're a good one, will start to tinker with their particular situation and adjust their exercises and their education and manual therapy accordingly.
That would be terrific if your company might have that type of program or a reference or a video that's available self-paced in addition to your physical therapy in person?
So
That program might be
all the
available.
patients-
I think that might be
all the
some.
patients that come into our clinic, Brian,
Yes.
after they get evaluated and we diagnose where their kink is coming from and we start the treatment, all their exercises are on videos. We send them to as we give. We don't give, like I said, a cookbook of exercises because everybody,
Right.
even if we have the right diagnosis, responds differently to each exercise. So the exercises are adjusted, almost every treatment, depending on how they're responding. But they do get videos of those exercises so they can follow them at home.
Sure. Great. Thank you so much. Appreciate it.
Absolutely.
Great
Yeah,
job, by the way.
we can help you
Very
with
helpful.
anything. Just give us a call. Okay.
Very well. Thank you.
Mhm.
Raul,
Yes.
is there some type of treatment? I don't know if I'm pronouncing this right, called Lobo treatment, where it's kind of like an epidural, but it's going directly to the source of the pain, like for example, a degenerative disc, where it can help stimulate the regrowth of the disc.
Lobo doesn't sound familiar to me. Regeneration of a disc.
Mhm.
From what I've read recently, and it's been a long time since it's been a little bit since I've kept up with this literature, they're doing disc replacements now. They're not hoping to regenerate the disc. They're actually doing replacements now of that disc because
Oh, okay.
the disc does not regenerate very well. The tissue source is not one that's going to regenerate. So they're actually replacing the disc, both in the neck as well as in the lower back.
That's good to know because I also suffer from degenerative disc when I had my MRI done. And that's what the doctor pointed out in my lower back. So probably another reason why I'm having these back issues.
Yeah, you seem fairly young. I don't think you'd be a candidate for a disc replacement.
Mhm.
I think the therapy that you're doing now, make sure it's incorporating a lot of strengthening, because that's what we see ultimately is the biggest benefit of therapy, is that strengthening and stabilization of those segments of your lower back and of your entire spine.
Yeah, definitely. Stretching and strengthening seems to be the core of what I need to address. Because
Absolutely.
with my current job, I sit a lot. And
Yeah.
I thought that by not being so active, I can reduce the risk of having back issues, but that currently is not the case. So,
Yeah. No, it isn't. You gotta really work at it. It's a challenge like everything else. If you want to help it heal naturally, it's work, and you got to put in the time and effort.
yes. Thank you so much, Raul.
Absolutely. Good to have you. If you can do anything for us, give us a call.
Will do. Appreciate it. Thank you again.
Anybody else have any questions before I sign off for tonight?
Ro, can you
Yes.
hear me?
Yes.
Hi, my name is Tally. I actually
Tally.
got off the video and tried calling the office, but nobody answered.
Wow.
I didn't leave a message. I called 3
Which
different
office did
times.
you call, Telly?
The West Hills location.
Okay. We're still here, actually. My receptionist just went home and she might have got caught up on another phone call.
That's fine. So with myself, I do have sciatica. My sciatica happened due to a car accident. Some dum-dum ran a red light and T-boned me.
Uh-huh.
And by me slamming on the brake, that's what caused my sciatica. And I do have a tilted pelvis also.
Okay.
So one of my legs is a little bit longer than the other.
Okay.
I have been going to physical therapy. They tried to, they didn't do the alignment that you just did to the lady.
Yeah.
They try to basically just pull one leg,
Yeah.
try to even them out.
Yeah.
So I've done that, but I also have the early stages of bone cancer.
Okay. Sorry to hear that.
Thank you. And I just turned 46 yesterday. So my whole thing is, do you guys accept insurance also, or is this?
We do accept insurance. We bill any insurance, Tali. We're in network with some insurances, out of network with others, but even the ones that we're out of network with commonly have out of network benefits that will pay us reducing your costs. But we are in network with a lot of insurances, so. we
Okay, so I will need to speak
clarification.
with Amanda if possible.
Yeah, give us a call. We'll be here tomorrow morning, and we can certainly take your call as early as, I think we're here at 7:30.
Oh, okay. I actually am gonna be, I don't know. Yeah, in your guys' building on the 6th floor.
Okay, do you work here?
Request. No, I have an appointment. I'm not able to work. I'm on SSI.
I got it. Swing by. We're here tomorrow pretty much all day.
Now my other concern is, I do have, a few referrals for, manual physical therapy, from a few different doctors. Now, I know there's a few of them that haven't been used and I haven't gone anywhere because I'm such a high risk
Right.
due to COVID. So how are you guys in the office? Is
What
basically
precautions are we taking? Yeah.
is the treatment just in one big room for
No,
everybody?
we have private rooms here. Most of the treatment is in a private room, so that tends to, keep people at ease that are at risk.
Mhm.
Everybody wears masks. We do, very thorough, deep cleaning of after every patient. We try to limit, the amount of people that we have in the clinic.
Okay.
Pretty much just work with a physical therapist. You're not being passed off to technicians unless you're going to go on a modality or something like that. But the therapist that you see works, about 95% of your treatment. So you're not being, passed off from one person to the other. We're screening people when they come in. Most people that are coming in are vaccinated as patients, and everybody in the staff is vaccinated. So all those things kind of help, help our keep our risk low.
Okay. So there are a couple referrals that I haven't used
Mhm.
that I can, if you guys do accept my insurance, I can transfer it. I can call and have it transferred to you guys.
Absolutely. Well, we're definitely.
So, I will see if I'm gonna, well, I'll either stop by or call you guys. I'll see how I feel in the morning. Every day is a different challenge throughout the day as well. So,
Yeah, if you can't stop by, if you're feeling up to it, come by, check out the clinic. You can see, our clinic, our facility, and maybe even meet a therapist. I won't be here tomorrow, but if you are, if somebody's available, they can talk to you briefly.
okay.
Okay.
Sounds awesome.
All right, Tally. Well, I look
All
forward
righty.
to meeting you at some point.
Thank you so much. I
Luck
enjoyed
to
the
you.
presentation, a lot of good information.
Great.
Thank you
I'm
so
I'm
much for
glad.
doing that.
No problem.
You have a blessed evening.
Same to you.
Thank you. Bye-bye.
All right, guys. I think I'm going to wrap it up here. I think we're out of time. If there's any questions, you feel free. The contact information is here on this slide also. Feel free to give us a call or email us at the emails, or just visit our website if you guys want to learn more about our company and what we do. Whether you're in West LA or in the Valley, West Hills area, we are here to help you. Okay, whether it's a free screen, like I mentioned, or a full evaluation to start getting treatment and feeling better right away. Okay, thank you guys for joining me. I'm going to sign off, and I hope to see you guys soon, and hope you guys wish you well with your pain if you're having low back pain and sciatica. You guys take care. Have a good evening.